Assalamualaikum and Salam Sejahtera. Zolpidem is a hypnotic that can be prescribed to treat patients with anxiety disorders, including insomnia, that might lead to depression. The National Pharmaceutical Regulatory Agency stated that the prescribed dose of Zolpidem is 10 mg per day and used for short periods, around 6 to 8 hours. A study conducted by Ling and Yan in 2020 reported that Zolpidem is one of the most prescribed drugs in treating depressed patients. Similar to other drugs, large doses and overextended periods of Zolpidem could initiate toxic conditions. Let us watch an interview between our reporter with a Zolpidem use patient in Harmony Hospital, Kuching, Sarawak.
This is Humaira reporting from 777 channel live at Harmony Hospital, Kuching, Sarawak. It is recently informed that more than one-third of adults in Kuching, Sarawak occasionally experience chronic sleeping disorder resulting in stress and affect their daily life. This includes patient named Aisha, where she had been admitted to the hospital and prescribed with few medications such as Zolpidem. Without further ado, let us interview Aisha regarding the use of Zolpidem as medication.
How did you know about Zolpidem?
My psychiatrist prescribed me with Zolpidem to help me to fall asleep due to my anxiety disorder.
How effective is in managing your insomnia?
Back then in time, I usually take 15 to 20 minutes for me to fall asleep after I took the pills. But then nowadays, it takes approximately few hours before I can fall asleep. Therefore, my psychiatrist increased the doses because due to the high tolerance.
Do you have any experience or any side effect after taking the medications?
I usually experience drowsiness, headache. Sometimes I'm slurring and losing balance.
How worse can it go?
My parents have to be fully alert with my well-being because I can, after I take the pills, sometimes I can do something compulsive like makan-makan. I even can go shopping, but this one is a rare case. It's not everyone who takes this can experience this kind of side effects.
Thank you, Aisha, for joining with us the interview for Report 777 channel. I think that is all for today. Thank you.
To conclude, drug use is usually the end of therapeutic consultation. Ensuring that the correct drug is given to the patient is high priority for all health professionals. I think that is all for today, and we'll be back with more news and update. Until then, stay tuned.
Hello there. The synthesis of Zolpidem. The starting material of the synthesis of Zolpidem is the 4-methyl-acetophenone. The bromination reaction of 4-methyl-acetophenone will give bromo derivatives. This bromo derivatives is further undergo condensation reaction with the presence of 2-amino-5-methyl-pyridine to give an imidazole-pyridine intermediate compound, highlighting that it is an intermediate compound. Then, the intermediate compound will undergo managed reaction to give an N-dimethylamino imidazole-pyridine derivatives. Next, these N-dimethylamino imidazole-pyridine derivatives will be converted into cyanomethyl imidazole-pyridine derivatives with the presence of methyl iodine quaternary salt. Then, this cyano compound will undergo alkaline hydrolysis to yield pyridine acetic acid compound. Then, the key intermediate will be reacted with carbonyl diimidazole. Finally, the last step is the amidation of intermediate with anhydrous dimethylamide to give Zolpidem as the end product.
Zolpidem is clinically effective and useful in treating patients with mental health disorders. However, it should be consumed at the minimum dosage for short duration. We hope that our video could create awareness for all. Thank you for watching 777.